Hello everyone. So lovely to see you all. Thank you all for coming. My name's Hanadi, and as Chris said, I am a nurse, and I'd like to tell you a slightly unconventional love story about falling in love with a village called Sulil. So I arrived in Sudan in October of last year, and shortly after I arrived, I was summarily put on a donkey and told to travel 4 hours through the mountainous region of Jebel Mara in South Darfur. So South Darfur, for those of you who don't know, is in the west of Sudan. And we traveled on these donkeys up incredibly steep hills and down into valleys for 4 hours in the sweltering heat until we reached this place that I've never seen before, with orange trees on either side, redolent with citrus, and a stream running through it, and from there to the hilltop village of Sulil. So you might want a bit of context, so let's walk back a little bit. I was working as a nursing activity manager in Sudan. So MSF at the time ran 3 clinics in the South Jebel Mara region of Darfur. For those of you who know a little bit of the history, there was an atrocious civil conflict in Darfur from 2003 to 2020. The area of Darfur in which we worked, the population had largely been cut off from access to healthcare for all of that time. There were tens of thousands of people killed in these communities, many hundreds of thousands more injured. Sexual violence was used systematically as a weapon of war for all of those years. This is a population who have experienced collective trauma in a way that we cannot imagine. And now they have no access to vital infrastructure. So in this region, there are no roads or no passable roads, hence the donkeys. The school buildings, if they exist at all, are crumbling. The teachers are volunteers, and they have no access to healthcare. So it was in that context in late 2020 that MSF first started working in the region. And over the last couple of years, they've expanded to 3 clinics serving this huge population over an area of mountainous regions with full services. So outpatient care, sexual and reproductive health care, childhood vaccinations, and a malnutrition program. But the team saw the limits of these clinics. Because of the distances and the lack of access to road travel, it was prohibitive for so many people. They couldn't travel on foot or by donkey up these steep passages. And at certain times of year, in harvest, for example, women had to struggle with the fact that if they left the farm to take their child to a healthcare facility, they'd potentially not be able to bring in enough of the harvest to feed the whole family for the long dry season. So they decided to try and bring healthcare out into the communities somehow. And that is where I come in, sweaty and saddle sore, arriving in Sulil for the first time. So my role was to do something incredibly exciting. It's called community-based healthcare. Now, globally, in the developing world, the 3 main killers of children under 5 are malaria, pneumonia, and diarrhea. According to the World Health Organization, the latest figures are for 2021. In Sudan, there were 50 deaths of children under 5 for every 1,000 children born. So compare that to the UK, the rate is less than 4. Now, I think we'll all agree that every single child death is a tragedy, but when those deaths are from an illness that is preventable or easily treatable, it's devastating. So community-based healthcare is a tried and trusted approach that's used by MSF and lots of other international organizations to manage the disparity in access to qualified doctors and nurses in lots of regions in the world. And what this involved was taking people from the villages, many of whom were barely literate, had primary school level of education, and teaching them the principles to treat and manage these illnesses, so malaria, pneumonia, and diarrhea. And that allowed them to identify sick children in their own communities and treat them before the illnesses became too severe. And it also empowers those communities to take control of their healthcare, to not feel that healthcare is something that happens outside of them, but that it belongs to them. So in the daytime, I was working with the community health workers and seeing the children and supporting them learning these principles and these algorithms. And in the evening, I would sit with the community and share our stories. One evening, early on, a woman came to see me. She was 22 years old, and she'd come desperate because she'd heard there was an MSF team in the village. And she's 22 years old, she's been married for 4 years, and she'd been unable to conceive. Now, when I heard this, my heart sank. Infertility is a deeply complex medical issue that even in contexts that are well-resourced, such as the NHS, we can't always do anything about. In a lot of the contexts where MSF works, care is completely inaccessible. And I listened to her story and I told her what I could, but I had to explain the limits of my ability to help. And I think I expected her to be angry or upset. And I was angry and upset. I joined MSF because I saw a disparity in access to healthcare between the richest people in the world and the most vulnerable. And it felt to me like an injustice that if I could have some small part in rectifying, I would like to. But she didn't become angry. She didn't become upset. She thanked me for my time and she left. And over the course of the next 6 months, I visited Sulil multiple times. I grew to love the community there, the people. I made friendships. Our incredible community health workers, in 6 months alone, they treated 200 children with malaria. They diagnosed 250 cases of pneumonia and over 1,000 cases of diarrhea. Just 4 people in a small group of villages saved that many lives. And all of those children were able to receive care near their homes rather than traveling miles to healthcare facilities. But I also met people like that woman that we couldn't help. And I think it opened my eyes because as healthcare workers, we're so focused on the fact that healing happens in hospitals and in clinics, but that's just not true. Healing and healthcare happens in our homes, in our towns, our villages, our cities. It's the mothers who stay up with us all night when we have a fever. It's the neighbors who bring us food when we're too unwell to cook. And it's the community, the family that come together to support us when we get the devastating news that we're unable to bear a child. I remember talking to the sheikh of the village, who I made good friends with, and telling him about London, where I grew up and have lived all my life, and how I don't really know my neighbours. And asking him about the sense of togetherness, the way the village comes together to share their joys and talk through their problems. And he was confused. He said, of course we do that, because we're a family. I feel incredibly privileged to have had the opportunity to do the work that I did, and I'm so glad to have been able to leave something of healthcare behind in Sulil, but I also feel like I learned so much from them about what makes a nurse and about what healing means. Unfortunately, this story doesn't end where I would like it to. You probably all heard of the devastating civil conflict that affected Sudan on the 15th of April this year. As a result, myself and the rest of the team were evacuated because of the fighting and because of looting in the MSF offices and warehouse. There wasn't sufficient medical supply, and the activities in South Darfur have had to be paused. As we speak today, there are MSF teams working tirelessly across Sudan. There's a project in Khartoum providing surgery to victims of the war. The projects in the east working with the refugees from Tigray in Ethiopia. in El Fasher in North Darfur, where there's been heavy, heavy fighting, an MSF-supported hospital is looking after hundreds of injured patients. And MSF facilities have sprung up in Chad and South Sudan on the borders, where tens of thousands of people have fled seeking safety. And although the teams have yet to go back to Sulil, I have no doubt that they will. And I know that the village will welcome them when they do. Thank you. So I'll just move out of the way. This is my supplies going to my community healthcare site. We had to take them on camels because the donkeys weren't strong enough. So you can see there the chairs and the jerry cans, the tables, is being supervised here by one of our medical assistants. This is one of our donkey trips. I've got a little team with me there. We're all going together to go and do a mobile clinic in Sulil. So that's our whole team, as you can see, on our donkey ride. And this is Sulil itself. You can see the mountain of Jebel Mara in the background. And as you can see, the state-of-the-art MSF facilities here. We've got plastic table, we've got plastic chairs, we've got hand washing point, and it just goes to show you can do healthcare with absolutely anything. I think that's it.